Have you ever wondered how our ancestors treated diseases before the advent of modern medicine? It's a thought-provoking question, isn't it? The past is a treasure trove of ingenuity, especially when it comes to medical treatments. Sure, some of the methods might seem brutal, even barbaric by today's standards, but they are a testament to human resourcefulness in the face of adversity. From drilling holes into skulls to using mercury as a cure, our ancestors left no stone unturned in their quest to heal and survive. These treatments, as terrifying as they might sound, are an essential part of our medical history. They reflect the evolution of our understanding of the human body and disease. They show us how far we've come and how much we've learned. So buckle up and prepare yourself for an intriguing journey into the past. Join us on this journey through time as we explore some of the most fascinating and terrifying ancient medical treatments. Imagine having a hole drilled into your skull as a form of treatment. This is known as trepanation. This ancient medical practice dates back to the Neolithic period, making it one of the oldest known surgical procedures. But who would have thought of such a drastic method? Well, it's unclear who exactly invented it, as it was practiced in various cultures around the world from ancient Greece to pre-Columbian Mesoamerica. The purpose of trepanation was believed to be the release of evil spirits. You see, people in these times didn't have the same understanding of disease as we do today. They believed that headaches, seizures, and other neurological disorders were caused by evil spirits trapped inside the head. And so, they came up with a drastic solution: to drill a hole into the skull to let these spirits escape. The procedure itself was as gruesome as you might expect. Using a sharp object like a stone knife or a drill, the practitioner would slowly and carefully cut into the skull. This would create a hole, or burr hole, which was then left open to heal. Despite the obvious risks and pain associated with trepanation, it's fascinating to note that many patients survived this procedure, as evidenced by healed trepanned skulls found by archaeologists. Despite its brutality, trepanation is an early testament to humans' understanding of the brain's significance. Our next stop in ancient medical history is the practice of bloodletting. This method was a common procedure in ancient civilizations, including Egypt, Greece, and Rome. The roots of bloodletting can be traced back to the early Egyptians around 3,000 years before Christ. It was believed that by removing a certain amount of blood, one could cure or prevent many diseases. The Greeks, led by the father of medicine, Hippocrates, and later Galen, continued this practice. They were convinced that the human body had four humors: blood, phlegm, black bile, and yellow bile. An imbalance in these humors was thought to cause illness, so by removing blood, they hoped to restore this balance. In Rome, bloodletting was often performed using a phleem, a sharp, narrow instrument. It was used to puncture a vein and drain blood into a bowl. This practice was particularly prevalent in the treatment of hemochromatosis, a condition marked by an overload of iron in the blood. However, the practice of bloodletting was not without its dangers. It often led to weakness, and in some cases, death due to excessive blood loss. It wasn't until the late 19th century that the practice began to decline as medical knowledge advanced. Bloodletting, although often harmful, reflects the ancient understanding of the body's circulatory system. Moving forward, we encounter the use of toxic substances like mercury as medicine. The tale of mercury as a cure stretches back to ancient China, where it was believed to be a key ingredient in the elusive elixir of life. Esteemed emperors and alchemists alike were seduced by the shimmering allure of this liquid metal, convinced of its ability to prolong life and even bestow immortality. However, what they didn't realize was that mercury, despite its mystical appearance, was a silent killer. While they consumed mercury-laden potions in their pursuit of eternal life, they were ironically hastening their own demise. The toxic effects of mercury on the human body are numerous and severe, ranging from nervous system damage to kidney failure and, in extreme cases, death. It's a chilling reminder of the perils of ignorance and the dangers of toying with nature's elements without a comprehensive understanding of their effects. It also highlights the lengths to which humanity has gone in its quest for health and longevity, even if the methods employed were misguided and ultimately harmful. Mercury's story is a testament to the evolution of medical science, a journey marked by trial and error, success and failure, discovery and loss. It's a stark reminder of how far we've come, and how much we've learned. The use of toxic substances like mercury underscores the dangers of medicinal experimentation without proper knowledge. Next on our journey is the infamous practice of lobotomy. This brutal brain surgery was not a product of ancient times, but rather a chilling chapter of the 20th century. The lobotomy was invented in the 1930s by Portuguese neurologist Antonio Egas Moniz, who believed that mental disorders were caused by problematic connections in the brain. The procedure involved inserting a sharp instrument, often through the eye socket, to sever connections in the brain's frontal lobe. Moniz's intentions were noble, aiming to alleviate the symptoms of mental disorders such as schizophrenia and bipolar disorder. However, the outcomes were often far from beneficial. The lobotomy was a treatment marked by horrific consequences. Many patients were left with severe cognitive and emotional impairments, while others lost their lives. Despite this, the procedure became widespread, with tens of thousands of lobotomies performed across the globe. The practice began to decline in the 1950s, largely due to the development of antipsychotic drugs and the growing realization of the procedure's severe side effects. It's a grim chapter in the history of medicine, a time when the cure was often worse than the disease. As we continue to advance in our understanding and treatment of mental health, we must never forget the lessons of the past. Lobotomy stands as a stark reminder of the suffering caused by misguided medical practices. Our next ancient medical treatment takes us to the macabre world of corpse medicine. Shivers down your spine yet? Well, brace yourself because the journey gets grimmer. In the 16th and 17th centuries, Europe was gripped by a peculiar medical trend. This was an era when the remains of the dead were not just buried or cremated, but also ground into powders, turned into tonics, or even directly consumed. Yes, you heard it right. Ground mummy and other human remains were used as medicine. This bizarre practice was born out of the belief that the vitality of the human body could be transferred from the dead to the living. It was thought that the essence of life was contained within the body's tissues and fluids, and consuming these could cure various ailments. From epilepsy to stomach disorders, the use of corpse medicine was widespread. Even the likes of King Charles II of England were known to partake, consuming a concoction known as the King's Drops, made from crushed human skull. However, as we moved into the Enlightenment era, a new understanding of the human body and disease began to emerge. This, coupled with a growing sense of moral unease, led to the eventual abandonment of corpse medicine in the late 18th century. Corpse medicine serves as a chilling example of the lengths humans will go to in search of cures. It's a stark reminder of the journey that medical science has undertaken, from the macabre to the modern. From the macabre to the bizarre, we now turn to bee venom therapy. This unconventional method of healing has its roots in ancient Egypt and China, tracing back to over 2,000 years ago. Back then, it was not uncommon to see physicians using bees as living syringes, exploiting their natural defense mechanism to treat various ailments. In ancient Egypt, bee venom was used to combat arthritis and other inflammatory diseases. In China, it was part of the traditional acupuncture practice where strategically placed bee stings were believed to balance the body's energy and treat chronic pain. Now you may be wondering, why bee venom? What's so special about it? Well, bee venom contains a potent compound called melittin. This compound has anti-inflammatory properties, making it effective in reducing swelling and pain. It was this understanding that led our ancient predecessors to use bee venom as a form of therapy. But it wasn't all smooth sailing. While some patients found relief, others experienced severe allergic reactions, sometimes even leading to fatal anaphylaxis. This highlighted the need for caution and further understanding of the therapy. Today, while we've moved on to more predictable and standardized treatments, bee venom therapy still has a niche in alternative medicine, particularly in treating chronic Lyme disease and multiple sclerosis. Bee venom therapy, while strange, is an early example of using natural substances for healing. As we near the end of our journey, we encounter one of the most unconventional treatments, Chinese fecal therapy. This practice, steeped in the pages of ancient Chinese medicine, dates back to the 4th century. It was known as yellow soup or golden syrup, a euphemistic coding to the decidedly less appetizing reality. The therapy involved the ingestion of a concoction made from the fecal matter of a healthy individual. The rationale? To restore the balance of the gut's microbiome. This was particularly targeted at patients suffering from food poisoning or severe diarrhea. You might be recoiling at the thought, but here's a twist. Despite its primitive origins, fecal therapy has found its way into modern medicine. Today we know it as fecal microbiota transplantation, a treatment used to combat hard-to-treat gut infections, particularly Clostridium difficile, a bacteria that can cause life-threatening conditions. The procedure has been refined, of course. Doctors now transplant the healthy bacteria via a capsule or an endoscope, saving patients the ordeal of the yellow soup. But the principle remains the same, harnessing the power of healthy gut bacteria to restore the patient's health. As unappealing as it may sound, fecal therapy is an example of the wide range of materials used in the quest for health. Our final stop in this journey of ancient medicine brings us to maggot wound healing therapy. Picture the Mayan civilization, flourishing in its golden age, where they turned to the unlikely heroes of healing, maggots. These wriggly creatures were introduced to clean out wounds, feasting on dead and infected tissue, and leaving healthy flesh untouched. This therapeutic method, though it might seem unsettling, had its benefits. By eating away the decaying matter, maggots prevented the spread of harmful bacteria, promoting faster healing. They were the unsung heroes in the Mayan medical world. In recent years, the medical community has revisited this ancient practice, with sterilized maggots being used in modern hospitals for wound debridement. This resurgence of maggot therapy is a testament to the wisdom of our ancestors, even in their most unconventional practices. While it may make our skin crawl, maggot therapy shows the ingenious ways our ancestors used the natural world around them for healing. As we conclude our journey through the history of ancient medical treatments, we reflect on the remarkable yet often brutal methods used by our ancestors. From drilling holes into the skull in a process called trepanation, to the bloodletting practices aimed at curing hemochromatosis, these treatments were born out of necessity and the limited understanding of the human body at the time. The use of toxic substances like mercury and the terrifying procedure of lobotomy remind us of the lengths humanity has gone to in the pursuit of health. The use of corpse medicine, the sting of healing through bee venom therapy, the unconventional Chinese fecal treatment, and the surprisingly effective maggot wound healing therapy all speak to the ingenuity and desperation of a time before modern medicine. By understanding our past, we can better appreciate the advances of modern medicine and continue to strive for better treatments in the future. Don't forget to subscribe to our channel for more updates and educational content.